Breaking news from
The Utah
KSL.
Department of Health and Summit County Health Department is announcing the state's third confirmed COVID-19 case.
We're following breaking news tonight. Another confirmed case of coronavirus in Utah, this one in Summit County.
It comes as the World Health Organization is now calling it a pandemic instead of an outbreak. And the Church of Jesus Christ of Latter-day Saints makes two major announcements, all safety precautions associated with the virus.
We have team coverage tonight covering all the angles: general conference, changes to the MTC, NCAA games with no crowds, canceled competitions for Olympic athletes.
That's a big list. Let's start with news specialist Dan Rascone on the new case in Utah. Dan, it's a third confirmed case here, but not community spread.
That's right. All three cases here in Utah are travel related. We had one man up in Davis County, over 60, one woman in the Weber Morgan area, over 60, and now a man from Summit County under 60 years old who traveled to Europe and came in contact with a coronavirus victim.
Today, the Utah Department of Health and Summit County Health Department is announcing the state's third confirmed COVID-19 case.
The latest victim is from Summit County, a man under 60 who traveled to Austria and returned home realizing he had symptoms and contacted health officials. He never physically entered a hospital.
The patient contacted a healthcare provider first through the University of Utah's telehealth system, Virtual Urgent Care, to be assessed for COVID-19. He let his providers know of his travel history and his contact with a confirmed case, his symptoms, and then clinicians from the University of Utah were able to prepare for that patient's visit and collect clinical samples without having him enter a facility and further expose other people.
Health officials say the man had been back to Utah just a few days, and they are now working to identify those he came in contact with.
For the public to understand the potential symptoms here of fever, shortness of breath, and cough, typical symptoms that one might have with the flu as well.
Health officials also say they're not surprised Utah has had another case.
I think as we see what's happening throughout the rest of the world and even in our country, it's not surprising to see more cases. I suspect that we will be continuing to see more cases in our community in Utah along the Wasatch Front and other areas as the weeks roll on.
Now we're being told that the man is recovering at his home, so it doesn't appear that he has life-threatening symptoms right now of the virus. The biggest thing that health officials want to get across is if you believe you have it or you have symptoms of it, don't go to the hospital, but rather make a phone call and they can do a virtual visit or some other way without you having to make more contact with the public. I'm Dan Rascone, back to you guys.
Yeah, and that's what they say happened, fortunately, in this case. Dan, thank you.